How does PaceWave work? Building on ResMed's proven ASV algorithm, PaceWave is the only ASV to target the patient's own recent minute ventilation for truly personalized therapy. Learning continuously, PaceWave sets and tracks reliable minute ventilation targets with split-second resolution. To reduce short-term oscillations in breathing, PaceWave stabilizes current ventilation at about 90% of the patient's own ventilation. Working with the patient's own metabolic demand, it maintains long-term stability, even during hyperpneas and hypopneas. Our most responsive ASV therapy, PaceWave responds rapidly within each breath with split-second resolution. Auto-adjusting pressure support helps keep ventilation on target, even as the patient's condition and their breathing changes throughout the night. When respiratory drive diminishes, pressure support adapts within the breath to maintain minute ventilation, stabilize breathing, and minimize respiratory-related arousals. When ventilation is sufficient, it provides a minimal level of pressure support in sync with the patient effort to enhance comfort. If the upper airway is closed, even the most advanced technology cannot stabilize ventilation. PaceWave offers the choice of two modes. In ASV mode, the pressure can be manually titrated for optimal fixed EPAP to keep the upper airway open. In ASV auto mode, PaceWave predicts the onset of airway collapse and auto-adjusts EPAP in response to flow limitation and snore to automatically maintain upper airway patency. If ventilation decreases away from the target, PaceWave increases pressure support and monitors how that affects minute ventilation. If there is little or no flow during this period, the advanced technology can deduce that the airway is obstructed. Once breathing resumes, it then increases EPAP automatically, in proportion to the severity of the event to prevent further apneas from occurring, maintaining an open upper airway. When the airway obstruction is resolved, EPAP gradually decreases to the minimum pressure required to maintain a patent airway. PaceWave constantly predicts each patient's unique needs, making it easier to care for even your most challenging patients. PaceWave also facilitates ease of care, with a range of well-designed functionalities, including a choice of manual and automated titration. Setup is easy, with default options designed for out-of-box performance. Optimizing comfort and synchrony, PaceWave is designed to boost patient compliance with their therapy. Breath phase mapping learns and predicts inspiratory and expiratory times to maintain synchrony with the patient's breathing. With continuous split-second resolution, PaceWave measures the patient's breath flow features to determine the patient's own respiratory rate. PaceWave uses this information to provide breaths in sync with the patient's own breathing. Its split-second response minimizes the length of time that the patient is without support. When required, the backup rate moves towards 15 BPM. PaceWave, with ResMed's unique Easy Breathe pressure waveform, replicates the wave shape of normal breathing to provide the most natural breathing experience. A range of comfort features, combined with PaceWave's predictive approach to synchrony, help the patient ease into therapy and remain comfortable during therapy. Learning continuously, responding rapidly, performing expertly, and optimizing comfort and synchrony, PaceWave does all this simultaneously, with split-second resolution. ResMed is proud to deliver the clinically recommended and comprehensive treatment for central breathing disorders. For more information, contact your local ResMed representative. PaceWave, ResMed's ASV therapy.